Hi, everybody. This is Julia Andrews, occupational therapy doctorate student at Rush University, and welcome to my doctorate capstone research project presentation titled Health Promotion in Low Vision, an Occupational Therapy Wellness Study. Here's a quick overview of what I'll be going over. First, we'll do a background, then a literature review, theoretical foundation, research objective and questions, methods, anticipated results and discussion, and finally a conclusion. For my capstone project, I'll be working with individuals with low vision. Low vision is defined by the National Eye Institute as a vision problem that makes it hard to do everyday activities and can't be fixed with glasses, contact lenses, or other standard treatments like medicine or surgery. I'll be performing my research at Second Sense, a nonprofit organization that works to increase the independence of hundreds of individuals with low vision due to a variety of conditions across the Chicago area. The organization focuses on independent living skills, technology use, and orientation and mobility training. Second Sense also provides its clients an opportunity to attend low vision support groups led by fellow individuals with low vision and offers resources regarding causes of vision loss, tools to aid individuals with vision loss, independent mobility, and communication. Though the services offered by Second Sense appear to fall under the scope of practice of OT, there is no OT on staff. Research suggests that adults with low vision experience mental health difficulties like depression at higher rates than individuals without eye disease. Additionally, individuals with low vision who exhibit symptoms of depression have also been found to have lower quality of life ratings than individuals who don't exhibit symptoms of depression. Emerging evidence suggests that the use of behavioral activation is effective for preventing symptoms of depression among individuals with low vision. Research also suggests that on average, individuals living with low vision have lower levels of physical activity than individuals of similar demographics without eye disease. Emerging evidence suggests that the use of adaptive tango dance for low vision is effective in improving physical abilities. Research suggests that individuals with low vision often have difficulty engaging in instrumental activities of daily living, or IADLs, such as community mobility and grocery shopping. Evidence suggests that typical low vision rehabilitation, driving and community mobility, low vision rehabilitation, and behavioral activation can be effective in increasing engagement in IADLs and community mobility. Finally, research suggests that individuals with low vision often have lower health literacy levels than individuals without low vision. Though the exact cause of this low health literacy is not exactly understood, research suggests that using plain language, avoiding hand gestures, checking for understanding, using high contrast and clear fonts, having good task lighting, and using an audio format when necessary can be helpful in improving the health literacy of these individuals. My capstone project will be grounded in the Person, Environment, Occupation, Participation Model, or PEOP, which considers how an individual's personal characteristics, chosen occupations, and environment interact to influence occupational participation. PEOP will be used as participants are asked to reflect on their supports and barriers to health and wellness, and how vision loss impacts them differently depending on their environment and task at hand. This study will also be grounded in the rehabilitative frame of reference. Interventions that fall under this frame promote engagement in meaningful occupations by helping clients increase their use of remaining abilities, adapt their environment to suit them, and use compensatory strategies. With the understanding that many OT interventions for individuals with low vision fall under this category, the study will include interview questions regarding the use of devices to support health literacy and occupational performance. Additionally, the health literacy skills framework will be used to guide my studies, interviews, and choice of my health literacy measure. The health literacy skills framework examines how health literacy and health outcomes are related and how health literacy is influenced by factors on the individual level. These factors will be addressed by examining the participants' health literacy as well as health and wellness. Finally, I'll use the World Health Organization's International Classification of Functioning, Disability, and Health, or the ICF, to guide my health and wellness aspect of my study. The ICF aims to create a worldwide standard language for discussing health and wellness. It outlines the health domains of body functions and structures and activities and participation. It also groups together domains for individuals with health conditions like low vision. This framework supports the use of health and wellness interview questions targeting body function and activity participation among individuals with low vision. My overall objective for this study is to understand the health and wellness status, as well as supports and barriers to health and wellness of individuals with low vision who receive services from a community low vision clinic. My research questions include: what is the overall quality of life of individuals who receive services from a community low vision clinic? And what is the level of health literacy among individuals who receive services from a community low vision clinic? The study will examine the overall health and wellness of individuals with low vision. Specifically, it will investigate the health literacy of participants and their overall quality of life. It'll be a mixed methods cross-sectional descriptive study utilizing semi-structured interviews. All participants will be individuals with low vision who are clients of Second Sense in Chicago. All eligible participants must be 18 years or older, able to communicate in English, and have access to a telephone. Unfortunately, individuals with comorbid developmental disabilities and/or learning disabilities will be excluded from the study. Given the small size of the community clinic, 15 participants are anticipated to be enrolled in this study. Participants will be recruited through a word-of-mouth convenient sampling approach. Announcements regarding the study will be made verbally during clinic group meetings and through the written clinic newsletter. Posts regarding the study will also be made on Second Sense's social media platforms. All written announcements will be written in plain English and use high contrast, clear font to increase accessibility. Study data will be collected with each participant for up to 90 minutes. Data will be collected and managed using REDCap. To express interest in the study, potential participants can call or email the researcher, me, to sign up for an interview date and time. Consent will be gathered on the day of the interview. To account for all levels of digital literacy, potential participants will provide verbal consent upon listening to the consent form read aloud. Consent will be recorded by the researcher via a digital consent form on REDCap, and a witness will be present. Interviews will be conducted over the phone and will last up to 90 minutes, including the consent. The interviews will be audio recorded using Zoom and transcribed verbatim. Before recording begins, participants will be reminded that the interview will be recorded and that their participation is voluntary. Both quantitative and qualitative data will be collected through these semi-structured interviews. Interviews will consist of a verbally administered abbreviated World Health Organization Quality of Life Questionnaire, or the WHO-QoL-BREF, which also has a background survey, and semi-structured interview questions regarding health literacy. The WHO-QoL-BREF will be used to understand the quality of life of participants and to gather general demographics information. It's been used across a variety of populations and has been demonstrated to have good internal consistency, excellent test-retest reliability, and excellent construct validity. It'll be administered verbally as part of the interview to account for the fact that participants with low vision probably won't be able to read the questionnaire themselves very accurately. Health literacy will be assessed using 4 open-ended questions with 3 to 5 prompts per question, as outlined in a previous study by Harrison and colleagues in 2012, which focused on health literacy among individuals with low vision. There's minimal anticipated risk to this study. However, with all human research studies, there is a risk of loss of privacy and confidentiality. To minimize this risk, written data will be de-identified and collected and stored using REDCap, which is a secure software. All audio recordings will also be stored in a de-identified format. And to minimize risk of loss of privacy and confidentiality, participants will be reminded to refrain from sharing any personal identifying information during the audio recorded interview. But if any information does come through, it will be redacted from the transcript. Participants will indirectly benefit from this study, as their participation will increase the overall knowledge and understanding of the health and wellness of individuals with low vision, but they themselves will not directly benefit. The findings in general may help contribute to the treatment and preventative care of individuals with low vision beyond just community low vision clinics and occupational therapy settings. Quantitative data from the WHO breath will be analyzed using SPSS. Descriptive nominal data from the background survey will be analyzed through examination of frequency and percentages. Ordinal ratio data will be analyzed through examination of means, medians, modes, and standard deviations. Data distribution will be evaluated using Shapiro-Wilk test for normality. Qualitative data regarding the health literacy will be analyzed through Braun and Clark's thematic analysis, and this thematic analysis will be performed using Deduce, which is a qualitative data analysis software. Results of the quantitative and qualitative data will summarize the quality of life and health literacy levels of participants. Results will likely indicate low quality of life and low health literacy levels among these participants. As past research suggests, individuals with low vision are more likely than individuals without vision loss to have difficulties with mental health, physical activity levels, IADLs, and health literacy. The findings will contribute to the understanding of supports and barriers to the health and wellness of these individuals, and this information will contribute to the understanding of OT's role in preventative care with low vision. Possible limitations of this study include the small sample size and the verbal administration of the WHO breath over the phone. Given the small size of the community low vision clinic, the sample size had to be small for this study, but future research in this topic might utilize a larger sample size to increase the accuracy of the results for the entire low vision population. Additionally, given the nature of the low vision population, the WHO breath had to be verbally administered, and verbal administration may potentially decrease the reliability and validity of this measure, since all the psychometrics that have previously been taken haven't been for verbal administration. So potential future studies might test these psychometrics for the verbal administration of the WHO breath to see if they're similar or not. This study will be disseminated in the form of a presentation with an audience of Second Sense stakeholders and Rush University occupational therapy staff and students. The completed manuscript will be submitted for publication as an AOTA Special Interest Section quarterly article, or SIS quarterly. It'll be submitted to AOTA's annual conference and ALOTA's annual conference, and it may even be submitted to AJOT. Overall, this study will contribute to the growing evidence of low health literacy and low health and wellness of individuals with low vision. The findings will contribute to the understanding of supports and barriers to health and wellness of individuals with low vision, which in turn will inform the understanding of OT's role in preventative care with the low vision population. Here are my references. Thank you.